And this is Dr. Brian Harasha, and I'm here to talk to you about something I'm very passionate about. I've been a chiropractor for 20 years now, and I've noticed in my aging population, people starting to talk about losing their memory or even getting a diagnosis like dementia or Alzheimer's. And there seems to be a real stigma around these diseases and a real hopelessness. And I notice people in that hopelessness will rush off to their neurologist or medical doctor in hopes to find a medication that will cure them. But even the Alzheimer's Association itself has stated that there's been no new drug approved for Alzheimer's since 2003, and that any of the drugs that are currently used are largely ineffective. So this kind of hopelessness is definitely scary. Alzheimer's is one of the top 10 diseases in our country, and the numbers diagnosed with it are growing year in and year out, even as some of the other diseases are becoming less and less frequent. It's also the only disease that we have that has no treatment and no cure. And on top of that, it's the only disease that's 100% fatal. So we've all probably heard of a cancer survivor, but no one has ever heard of an Alzheimer's survivor. So what makes matters worse is that death is not the worst part of the disease. It's the slow, insidious nature. It usually starts with simple things like often forgetting where we left our keys or forgetting people's names, although that a lot of people do have that problem, but it is an early sign of memory loss. And the decline just slowly goes on from there. People might not be able to perform their job duties. People might start forgetting more and more important things. They have to write more and more notes all the time to remind themselves. They might have a hard time reading books because they'll read a page and then forget what they just read. They might even have a hard time with movies because they can forget the storyline. And eventually, they start even distancing themselves socially because they're worried about forgetting too many things. They might even start driving less because they're worried about getting lost. And this just continues to get worse and worse till people start to just lose an understanding for the places and people around them. They start to just lose their humanity. And eventually, they can't even perform their daily activities and will need a full time caretaker. So the burden of this disease just is immense. The cost itself, it's the most expensive disease someone can have. It is said that it'll cost $350,000 to go through the experience of having Alzheimer's. And people will often have the disease for 10 to 15 years. So that comes to about $40,000 a year in direct and indirect costs. And insurance tends not to pay for most of these. And then there's the effect of the impact on the caregiver. Just think of all the work that has to be done and all the sadness as more and more functions are lost. But there is hope, and that's what I want to talk to you about. So there are neurologists and researchers who have seen that drugs are not the answer. One is Dale Bredesen. He's a neurologist who wrote a book, The End to Alzheimer's, and in 2014 wrote an article to the scientific community proving that he was able to reverse cognitive decline in 9 out of 10 of his subjects. And year after year since then, he's been proving that he's able to have great success. He's got a very thorough protocol. It does involve intense lifestyle and diet changes and taking nutritional supplements to help restore function in the brain. So also, laser therapy has been shown to have great effect too. I've been a laser therapist for 3 years now, and I've noticed in the research more and more articles showing the benefits of laser therapy on restoring brain function and improving cognitive decline. And there are only a few laser devices on the market that are safe to use on the brain, as you can imagine. And I'm proud to say I have one of those lasers, so I'm able to use this to help improve brain function. So between Dr. Bredesen's protocol and laser therapy, I'm showing great success in helping people with cognitive decline. So please look for more videos from me that will go into more detail about the things we just talked about. And I invite you to use the links below this video to follow me on social media. I'll be constantly updating progress in this area. You could also email me some questions you might have. And better yet, you can even schedule a free 15-minute phone consultation with me to discuss your particular concerns. Thank you.